to As Goes Wisconsin on this beautiful Monday, November 13th. Greg Bach with me in the studio. Calvin is on the board. You can always join us, call or text at 844-967-2789. Coming up at 11:33, Benjamin Garbedian is going to join us talking about a new bipartisan measure that is moving through the Wisconsin legislature that would help address the mental health crises on college campuses and how they can fight that. So that's going to be coming up at 11:33. Right now, though, very excited to have join us again. Second or third time? Mark Sommerhauser is our guest. He is the communications director and a policy researcher with the Wisconsin Policy Forum. Good morning, Mark. How are you?
Good morning, Jane. Thank you for having me.
Absolutely, it's a pleasure. I've been kind of avoiding you data people while Kristen is gone because I don't want to look like a moron. But when I read your report, I actually understood it. And I thought, well, then we can talk about this, right? Then we can talk about this. Definitely. So we're talking about housing and your recent report. Wisconsin is outpacing the nation in the trend towards smaller households. So obviously, Mark, I think it's been a trend for at least a decade that people are having fewer children, right? Family sizes are getting smaller. But what are the other trends that you're seeing that is leading to this?
Yeah, so that's right, Jane. You're definitely correct about fertility rate declining, numbers of children being born. So when we think about like contributing factors to this trend, I would put it in two buckets. The first of which is sort of family and relationship, sort of cultural changes in that area. One piece of which would be fewer children being born. The other would be declining marriage rates. So that's kind of one bin, right? The other bin would be just people living longer. And that's something that we've seen, so we looked at a period of 50 years in our research, starting in 1970 and going through 2020. And, as life expectancies have increased, especially more toward the first 2 to 3 decades of the period that we studied, that has had a big impact because obviously people later in life are much more likely to live in smaller households, 1 or 2 person households. And so, that's one of the biggest driving factors as well.
And we lack housing. We lack the correct number of housing. And are we building smaller houses, Mark, or are we still building big 4-bedroom, 2.5 bath houses?
I think the answer is that we are building more, certainly apartment housing that is, 1 or 2, made for 1 or 2 people, but not quickly enough. And I do want to actually give a shout out here to John Johnson, who's a researcher at Marquette University Law School, who did some research over the summer that got us kind of thinking about, we'd already been kind of interested in this issue of declining household size, and we thought it was really important in a number of ways that maybe were being overlooked. But he really helped us think even more about how the issue of declining household size relates to housing specifically. And he did a blog post for Marquette University. You can find it at their website, at the Marquette Law School website, that kind of talked about, just focusing on the Milwaukee area, how even though Metro Milwaukee has been roughly flat over the last decade in terms of its population, it has seen an increase in the number of one-person households, almost 10,000 more one-person households in Milwaukee over the decade from 2010 to 2020. And he went and was able to run down the number of new single-person housing units that have been constructed in Metro Milwaukee over that period, and found that it was not nearly as many new units as the number of one-person households. Now, obviously, some people in a one-person household have the income, have the means to live in a larger, in a housing unit that's built for 2, 3, 4 people. But of course, we know not everybody, has the means to do that. And so that's where we can kind of see some of the issues with the types of, mismatches that we talk about in the report that kind of rise between the housing stock that we have available that was maybe built, during a time when households were much larger on average versus the demand that we have here in 2023.
If you're just joining us, Mark Sommerhauser is our guest. He is the communications director and also a policy researcher for the Wisconsin Policy Forum, talking about how Wisconsin is outpacing the rest of the country when it comes towards the need for smaller households. You had mentioned the declining marriage rates, Mark. does that also mean that so fewer people are getting married, are fewer people cohabitating as well?
Yeah, I'm not sure. Our research did not actually take that into account. And it's actually a really good question. It's something that I would kind of be curious to know the answer to that. I know we looked at things such as fertility rate, marriage rate, divorce rate, those types of factors. Um, and we've seen a decline really in all of these things. We've seen a decline in the number of children being born, the marriage rate, as well as the divorce rate actually has gone down. That's something that I'm not sure everybody's kind of aware of, but all of these things have kind of gone down a little bit over the period that we studied. And the first two, I think, are we kind of identified as being some of the contributing factors to this decline in household size.
I find that so interesting, though, that are we just getting along better now that we're not getting divorced as much? Or is it just that fewer people are getting married and therefore we're
Yeah.
having fewer divorces?
So that's a great question, and obviously I can't fully answer that one. The one thing that I can say that I did come across in my research, and this probably won't come as a shock to you or your listeners, but I know the average age of first marriage has really increased over the period that we looked at. And so that certainly makes you wonder, could that have an impact on the divorce rate if people are getting married a little bit later on in life, perhaps in a position where they're able to make a little better decisions about who they're coupling with. So that certainly seems plausible. Yeah.
What about multi-generational households?
Yeah, that's one of the really interesting pieces here because, and we didn't delve really deeply into that, but we looked at it a little bit, and the data seemed kind of mixed on that front. What we were able to see pretty clearly is that during the early period of when we studied the 1970s, 80s, there was clearly a really marked decline in the U.S. in multi-generational households. And then in the most recent sort of decade or so, actually the data points to somewhat of an uptick in multi-generational households. So it seems like that has sort of moved around a little bit, and that's going to become, I think, an important thing to watch, particularly as we continue to see an aging population, as we continue to see, especially the baby boom cohort continue to age. Are we going to continue to see actually an uptick as we saw in the past decade in 2-3 generations in some cases of families living together? So that's going to be something to watch, I think, going forward.
And I also think that there are a growing number, particularly of women and senior citizen women, who are electing to get roommates essentially and live together. And again, this does seem to be primarily a female-driven trend.
Yeah.
But I think we're going to see more of that going forward. I do. If you're able to live on your own, that's obviously most of our desire. Nobody wants to go into a facility if you don't have to. So sometimes having another person to help cover the rent or help
That's
cover.
what I was going to say. I mean, that certainly would fit with kind of what we were talking about. And, we know that the cost of housing has become such a challenge for so many people. And so, perhaps if you're in a community where you're having trouble finding a single person unit that you can afford, but there's somebody that and trust that you could team up with to get a larger housing unit, that certainly might make sense.
Well, and it's interesting when you mentioned the price of housing, and I saw this article this morning. It is still being recommended that if you can, the way to grow your wealth is that one of the best ways is still to own a house.
Absolutely. Yeah. I mean, that's for most people, their housing, whether it's a rent payment or a mortgage payment, is still going to be their single biggest monthly bill. Right. And so, it just kind of is, I don't think it's difficult for most folks to understand that if you're paying that toward an asset that you own that's appreciating in value, rather than paying it to a landlord, that's going to be a big benefit for you long-term financially.
Absolutely.
Yeah.
So what does all of this mean, Mark? What kinds of things do we need to look at building so that we're going to be able to accommodate these changes?
Yeah. So I think our report just kind of touches on at the end that, I think communities need to look, because housing is always a local issue, right? And so some communities are going to have different needs than others. But most communities in Wisconsin, I think it's fair to say right now, would benefit from seeing more housing units constructed to increase the supply of housing, which in turn, should make housing at least a little bit more affordable. And I think what we're saying is that policymakers might want to think about, kind of where the demand is. And the reality is just that we can look at these demographic data and see that the demand is going to be for smaller housing units going forward. And so that's something I think that, at the local level, when they're thinking about planning, when they're thinking about zoning, in some cases, maybe incentives for some communities for developers to build housing, that they think about this growing when there's every reason to think that this trend is going to continue. The projections we looked at for the next 2 to 3 decades suggest that at least in the near term, household size is going to continue to decline, that we're going to need more 1 and 2 person housing units in many of our communities. Now, again, this is always very localized. I live in the Madison area where we're seeing, pretty significant population increases. So that only sort of compounds this issue, right? If you've got more people moving to a community,
right,
and you already don't have enough of a certain type of housing, and so that can be a little bit of a different dynamic than a community like Milwaukee that's not really growing in population. But again, I think, looking at John Johnson and other people's research, there still is a need, even in communities that aren't increasing in population, for some of these smaller housing units.
Well, and just overall too, I'm thinking that the housing issues that we're seeing, not just in Wisconsin, but across the country, but in Wisconsin in particular, if we want more workers to move here, they're going to have a place to live.
Yeah, that's absolutely right. And the housing, the problem of affordability of housing is something that's national in scope. It's not just a Wisconsin issue, but absolutely, I think this is an area where potentially a lot of communities in the Midwest can possibly gain a little bit of a competitive advantage, because if you look at what's going on with housing markets in some other parts of the country, it's even more crazy. And so there is an opportunity.
It could be worse. It could be worse.
Right.
Mark Sommerhauser has been our guest from the Wisconsin Policy Forum. Thank you so very much for your time, Mark. Greatly, greatly appreciated. Take care. When we come back, and we will be back.
Yeah.
We will still be As Goes Wisconsin, and you'll be listening on the Civic Media Radio Network. Good morning. Welcome to As Goes Wisconsin, 20 minutes past 11 o'clock. Jane McNair in for Kristen Bry. Greg Bach is with me in studio. Calvin is on the board. You can always check in if you want to call or text at 844-967-2789. Or if you're watching on the live stream on Facebook, YouTube, or Twitter, you can also leave a comment right there, and we will see it. Couple things to update you on in case you missed it. Republican Tim Scott, presidential contender, announcing last night he is suspending his presidential campaign. Quote, "When I go back to Iowa, it will not be as a presidential candidate. I'm suspending my campaign. I think the voters, who are the most remarkable people on the planet, have been really clear that they're telling me, not now, Tim," unquote.
Not ever, Tim.
I thought he was a pretty strong contender, at least initially.
I mean, he speaks a good game like the other. Like he's got the Nikki Haley approach, I think, which is, the issues, you come across as
reasonable
on the ideas, but at the end of the day, man, some of the things he says, I'm like, dude.
Well, and I still think, and this is not fair, but I still think the fact that he is a 47-year-old man who has never been married was an issue for some voters.
Absolutely.
Right?
Oh my God, yes.
It was seen as suspect.
But we'll vote for the 3 times married, cheated on all his ex-wives and current wife. I mean, that's a man right there. That's an American man.
Upholding American values.
Yes. Yeah.
So Tim Scott is out again, as Todd educated me a couple of weeks ago, suspending his campaign so they can still raise money.
Exactly. Yeah.
To retire their debt, which is not this.
Perfect.
I know this is not unusual, but I still think those and fundraising phone calls have to be excruciating to make.
You don't make them phone calls. When you retire your debt, you throw parties.
Oh, is that what you do?
You mix some sugar in with the sour,
with the
medicine,
with the loss.
Yeah, exactly. You might call some of your buddies like privately, be like, "Hey, can you cover this? Help me out." But you're not dialing for dollars like you would if you were in office. You throw a birthday party, you throw a holiday party, you do,
and you charge what, $500 a ticket or whatever,
and you put it right on the you put it right in the flyer, say retire the debt party. That's how normal it is.
Wow.
Yeah. So yeah, I mean, yeah.
I-
Plus,
I-
who knows? Maybe next year Tim Scott comes out like a phoenix out of the ashes. He's like, I'm back, baby. I'm married. I kissed a lady.
that could happen.
I put nothing past anything anymore.
Lots of things could happen. I still find it remarkable because I predicted this before we went on vacation in August
Yeah.
that Ron DeSantis would have been out by the time I got back.
I mean, that is just so interesting. Ron DeSantis is a study, in my opinion. Like a couple of weeks ago, a caller made the very correct comparison between him and Scott Walker. After I made a terrible comparison between him and Paul Ryan, I'm still kicking myself for that. Like, I almost forgot who Scott Walker was. He's been Men in Blacked out of my mind.
If only we could.
Yeah,
If only we could.
But Ron DeSantis, I just felt like Ron DeSantis had a little more fire in his belly to like kick back with those boots with the lifts in them.
Right.
And I'm just surprised that he's falling so fast. And yeah, see, it's November. My guess is by Christmas he'll either be gone or he'll be so on life support that he's not even a serious candidate. Like they won't even care anymore. They'll be like, eh.
And who's going to give him money now?
I don't think anyone is.
With his numbers so bad. So I guess why continue to stay on the campaign trail and rack up more bills when you're such a long shot?
In order to run for that office, you got to have a little bit of delusion, and you surround yourself around people who tell you you're doing
wonderful.
Great. And seriously, he was the only example of a quote unquote red wave when he was reelected. He was elected so handily that I'm sure he has that ego, that drive in him. Says, well, the people of Florida love me. I'm like, well, the people of Florida aren't the people of this country.
Of the country.
And that's no knock against Florida. That's just how it is.
Well, and I'm not even so sure that most of Florida is all that enchanted with Ron DeSantis anymore.
Oh, I think he'll have a very strong primary challenger, and I cannot guarantee that he will win re-election. And this might be the thing that kicks Florida towards a solid deep purple.
You think?
I think so, because when you have a guy who's so divisive as him and says such terrible things,
the throats. We're going to start slitting throats. If I'm elected president, Ron DeSantis said, we're going to start slitting throats on the first day I'm in office.
And the GOP of Florida might be like, this ain't our guy anymore either. I mean, it might come from both sides. That's what I'm wondering at this point, is if someone just says, hey, you get Rick Scott, who's like, I'm back, baby. I want to be back in Florida.
Well,
you know what I mean? So like, it'll be interesting to see where Ron DeSantis, because Ron DeSantis still has most of his. Oh, actually, you know what? I take that back. I don't think he can run again.
Oh, he's term limited.
I think he's term limited.
You're right. He's term limited. And I saw over the weekend that Casey, his wife, might consider running.
Gross.
Yes.
I mean,
Casey might for governor of Florida.
That's straight up some Putin stuff right there.
Keep it in the family.
She runs once. She does it once. He can come back.
Keep it all in the family if you can. And we do want to offer condolences. Donald Trump's older sister and retired federal judge Marianne Trump Berry has died, according to the New York Times, 86 years old. She was the oldest child of Fred Trump and Mary Ann McLeod Trump. She was found in her home on the Upper East Side of Manhattan on Monday. No cause of death has been released. Her niece and Donald Trump's niece, Mary, said in her book, Too Much and Never Enough, that her Aunt Mary Ann had called Donald Trump a clown during the 2016 election.
What I'm about to say is not disrespectful to the dead. I'm just going to say this. Trump Berry, I'd put that on my toast.
Trump Berry?
Because her name is Trump Berry. Trump berries. Would you like some Trump berries with your pancakes?
No, thank you.
You don't?
No, thank you.
Oh my gosh, you don't want it on your sliced bread with a cup of coffee?
Like Todd Alba
There
said,
it is.
Which is the pinnacle, apparently, is a piece of bread and a cup of coffee.
The Todd father never disappoints when it comes to words. He's so good with words.
He is. And speaking of the Todd father, make sure you listen to the Todd Alba Show across the Civic Media Network. He kicks off at noon until 2 o'clock every Monday through Friday, from noon until 2 p.m. All right, coming up, we are going to have with us in studio Benjamin Garbedian has been working on this for a while. They want to remove barriers to mental health care by allowing out-of-state providers to practice here in Wisconsin via telehealth technology. So this is about getting more help, especially to our kids on campus who might be having issues and needing some counseling. And I've talked to several people just in the last couple of weeks who have been trying to make appointments with counselors, and they're going months out.
Yeah,
You're going months out.
It's crazy right now. It's crazy. I mean, sorry, that was a really bad choice of words, but
It's really difficult.
it's
right now.
difficult and it needs to be better.
We will kick that around when we are back. Stay with us. You're listening to As Goes Wisconsin. This is the Civic Media Radio Network. Good morning. Welcome to As Goes Wisconsin. Jane Mantner in for Kristen Bry. Greg Bach with me in studio. Calvin on the board. 11:34. And joining us also in studio, we haven't seen you for a couple of months. Benjamin Garbedian is here. And let's talk about, you were on the show in March, correct?
Yep.
And let's recap a little bit about what that conversation was about.
Of course. Well, thanks again for having me, Jane.
Of course.
Always a pleasure. So back in March, I came on to promote a op-ed that I had written. I was a student fellow for the Institute for Reforming Government. We were looking at solutions to common sense solutions to problems that a lot of Wisconsinites face. And mental health is one of those. The governor declared it the year of mental health in his State of the State earlier this year. And we have a proposal to make it so that people in Wisconsin can access therapists in other states via telehealth and Zoom and the magic of the internet. So this bill is working its way through the legislature right now. It got introduced about a month ago, and it's in the process of getting voting. So I'm on here to talk about that.
No, so you testified about it last week.
I did last week, Wednesday. Yeah.
What was that experience like for you?
It was really fun.
Was
I'm
it?
a massive nerd, but it was really fun.
No, that sounds fun.
Yeah.
That sounds really cool.
It was great. We went we went to the Capitol. It was the Assembly Committee on Health, Aging, and Long-Term Care. Me and Chris Reeder of IRG went and sat there. That we gave our presentation. We basically talked. I talked about my personal experience. He talked about the legalese of the bill, and then the assembly members asked us questions and got to hear our opinion on a bunch of different things regarding mental health. It was really fun.
Anybody hold your feet to the fire? Anybody try and back you up against? I don't know why. What would be the argument against something like this?
So someone will find an argument.
Well, there's always that one who's like, I don't think we should do this.
There wasn't anybody who was, I don't think, vocally opposed, but there were definitely people who thought that there were ways to make the bill better. After the testimony on Wednesday, it actually got 2 amendments that we do think make the bill better. So,
and what are those amendments?
One is a clarification that says it's only mental health professionals, so physical doctors this doesn't apply to. And the other one is a sort of technical thing that makes it easier for Wisconsin's government to receive the paperwork from other states so that we actually know that they have a license in Illinois.
Oh, that's...
So people can't just say, I have an Illinois license, and we're just trusting them.
Sure.
Oh, yes. Yes. Yeah.
Well, and I would think, Benjamin, too, I find it kind of surprising that this hasn't already happened.
So do I.
Because especially during the COVID pandemic, when so many people were unfortunately ending up in crises and needing to talk to someone, and we couldn't do anything face to face. I would have thought that we would already have been working with therapists from out of state.
Well, so the interesting thing, the important thing to remember is that this kind of did already happen, because for the 18 months of the pandemic, Governor Evers had signed, it's called Emergency Order 16, and that allowed us to look at therapists from other states. But when the pandemic was declared over as a public emergency, that went away.
Oh,
so we had this.
We had it already.
It went away.
That's really interesting. That is really interesting. So, why does this matter? Why is this important?
Mental health is, I think, one of the most pressing issues that we're facing today. I'm not saying it's the only one. I'm not saying it's the most. Reasonable minds can disagree on what's really big. But IRG did a thing last year called the What Wisconsin Wants Tour. We held more than 60 listening sessions across the state, and we did it with a ton of groups. We did teachers, lawyers, doctors, farmers, anything you can think of, young people. Anything you can think of, we probably did a group on it. And every single focus group, people talked about mental health.
Really?
It was shocking to me because I was expecting it from the college students. I was expecting it from teachers to a degree. I was expecting it obviously from the doctors.
Yep.
But we met with farmers in Western Wisconsin who said, yeah, mental health is really important here. We don't have access to it. It was fascinating. So this is, I think, a universal issue. And Tony Evers has put forward his proposal. We wanted to put forward some of ours as well because I think this is something that everyone should agree on.
I yeah,
Absolutely.
absolutely. I mean, the fact that makes as someone I've said it before on the show, as someone who struggles with mental health issues,
Mm.
and being a man, I think it's so inspiring and beautiful to see grown men say, "Yeah, we need help. I need help," and not just stuff it down like we were told to, or our fathers and grandfathers.
Yes.
So the fact that we're opening up, especially men, for me, that's a big time deal, and I love this.
Yeah.
Well, without a doubt. We had John Dietrich on from the Milwaukee Journal
Yeah,
Sentinel either last week or the week before, talking about the shocking number of gun suicides
Mhm.
in Wisconsin and the fact that even among gun owners, now there is starting to be some more open discussions about how are you feeling?
Mhm.
Do you need me to watch? Do you need me to take this for you?
yeah. People are
Do you need
holding
me
their
to
guns for each
holding their
other.
guns if you're in crisis? And so that is all good. That's certainly a step in the right direction to try and get rid of some of this stigma, right?
Yeah. Yeah, and there was a lot of stigma. I think there certainly is still a lot of stigma, but we're seeing more and more people come into the open with this and share their stories. I mean, just personally, I published the op-ed was published back in late March, and the amount of people and the specific people who reached out to me to say thank you for sharing your story. Here's mine was astounding to me.
Really?
Yeah, because it was friends of mine, college students, people I expected, and people, frankly, that I'd known about. And then there were people that were professional colleagues of mine, people I'd met in politics, who just blew me away. So.
If you're just joining us, Benjamin Garbedian is our guest, and we're talking about some legislation that is moving its way through the legislature that would allow Wisconsinites to actually get telehealth appointments with mental health professionals from around the country.
Yep.
And some of the numbers I'm seeing from the National Institute of Mental Health, nationally, almost 23% of adults are living with mental health issues. That jumps to 49.5% for kids between 13 and 18.
Yeah.
Oh yeah.
The
That's just staggering.
it's insane. The one that shocked me the most, and I think it's also from the National Alliance on Mental Illness, is uh, of people who will have a mental illness over their lifetime, 75% of them will begin showing signs of it by age 24.
Wow.
So it's just a fascinating thing that like this starts when you're young.
Yeah.
Mhm.
Um, and it obviously 75 is not the whole thing. You can have it when you're older, but the fact that this is hitting so many young people, so many teenagers, middle schoolers, high schoolers, college students right now, I think this is more vital than ever to speak about and to try to fix.
Um, I want you to share your story so people know where you're coming from, if you would, please.
Sure. Yeah. So this is in the Journal Sentinel. You can look up the op-ed if you're curious. Uh, Last year in the fall of 2022, I was getting stressed. I mean, I've always been a little bit stressed. I lead a very busy lifestyle. I enjoy that kind of thing. And I like politics. I like school, friends, social life. The things that happen in a 21-year-old's life just kind of built up. And I had some things happen in my personal life. And a couple days after, I started experiencing panic attacks. And I'd never really had that
How
before.
did that manifest for you?
Uh, it 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 started with hyperventilating and then got sort of continued there, and it's literally just I feel like I can't control physically what's going on for the next however many minutes. I mean, usually it's half an hour ish. But it's a scary thing. And I had a panic attack. I was alone at the time, and I worked my way through it. I didn't really know how to work my way through it. I just kind of sat there, tried to calm my breathing, drank some water. Um, And that was in the evening. The next morning, I woke up and I was like, all right, I have to fix this. And I began looking for therapists and discovered as you call through places and as you go on websites and check, um, most therapists in Wisconsin were booking out months on average, weeks if I was lucky. And I happened to find someone. I got the care that I needed, but so many people aren't. And so I worked for IRG at the time. I was actually actively an intern at the time, and just came to CJ a little bit later after the state of the state, and I said, the governor wants to tackle mental health. Here's what I've experienced. Here's where that matches with him. Here's where that doesn't match with him. Can we work on this? Can we come up with something? And he said, go for it.
Did we do something bipartisan? Oh, stop it. I just can't. I can't. It is actually nice to see something actually get through with the support of both parties. It can be done.
It gets done more than we know, honestly.
Is it just that we don't hear about it often enough when there is actually agreement on legislation?
I think so. Yeah, I don't have the numbers exactly in front of me, but the legislature passes several hundred bills every year, and something like 60 to 70% of them are first of all signed by the Democratic governor. That's bipartisanship in and of itself.
Sure.
A lot of them pass.
Yeah.
With wide or unanimous margins. The thing is, just most of them are,
They're not very sexy.
Let's build a bridge.
Sure.
Let's do things.
Yeah.
And I'm sure those are important to those people, but they're not the huge sweeping mandates.
They don't. They some people don't think they deserve column inches. That's
Well,
that's
and
unfortunate.
again, but it would be nice to be able to highlight a little bit more often that we do actually sometimes get things done.
I like that.
I'm down for that.
We
too.
can make that a segment. Hey, we actually got something done.
And
I like the sound effect.
thank you. I just did that off the top of my head. I'm very proud of myself.
I
right
don't
now.
think I could have done that. That's good.
I don't know what's happening. Oh, this is amazing.
Multi-talented Greg Bach.
Okay. All right.
So when you published your op-ed, if you would share some of the other experiences you heard from people, because it must have been more than not to discount your panic attack, because that's got to be terrifying.
Well, that was the first one. I had several.
Oh my.
Yeah, it was 4 over the course of about 2 months.
Wow.
Yeah. And it was after, because I had the first one, I started seeing a therapist, and then I kept having them, and I was like, what's going on? Why is this? So it was just that I hadn't fully worked through some stuff yet. So I haven't had one in nearly 10 months now. So
that's great.
Yeah.
That's great.
Yeah.
It's not an easy fix. It's not, I'm going to talk to one therapist one time and boom, I'm done and I can go on with my life, right?
Nope, not at all.
It's an ongoing process.
I will say, for some people, they do only need a couple meetings. It's just, you had an instant event, death in the family or something, and you need to work through that. But for some people, yeah, they'll be seeing a therapist for the rest of their lives, or at least for months or years, or a significant amount of time.
And I think it's important for folks to know too, that much like a doctor or a dentist or a hairstylist, you don't have to go with the first one that you hire, right?
Yeah.
That's very true.
Because you can break up with your therapist.
Yes, absolutely. That's something I've talked to many times with many people with regard to both those points, actually. One, and especially guys will think, well, I went to therapy for a couple of times, nothing happened. Like, it's called doing the work, and you might have to be in there for a while. You got to put that work in. It might be 6 months, it might be 6 years, but there's no guarantee on either side. But also, if they're not your jam,
right,
done.
Yeah.
I've broken up with more therapists than I care to admit, but they don't connect. And that's important to realize that you can't. A lot of people are like, well, I don't want to not do that. I feel bad. They're not going to feel bad. And if they do, that's not your problem. You got to take care of yourself.
And frankly, if you stop seeing them, they're free to see other patients too. So you both find a fit that's better for you.
Right. Well, we are going to be right back. Ross, I see you on the line. If you have a question or a comment, you can text and or call at 844-967-2789. Benjamin, if you got the time, we'll keep you on the other side of the break.
Of course.
That would be great. Stay with us. You're listening to As Goes Wisconsin. We're on the Civic Media Radio Network. Good morning. Welcome to As Goes Wisconsin. Jane Matnair in for Kristen Bry. Calvin is on the board. Greg Bach with me in studio, and also Benjamin Garbedian, who is working for the Institute for Reforming Government and moving a measure through the Assembly and the legislature that will allow Wisconsinites to access mental health therapists via Zoom and via other electronic means. And it's looking pretty good that this is going to pass.
We think so. Yeah, we think so. So the measure, as you said, would allow Wisconsinites to access therapists in other states via Zoom, via other telehealth measures. We heard, it was the Assembly Committee heard it last week. We testified. I went out to Madison to testify on Wednesday. They voted it through on Thursday, and it will go to the full Assembly floor tomorrow. So we're hopeful that it passes tomorrow, and then it moves on to the Senate after that.
That would be great.
Yeah.
844-967-2789. 844-967-2789. Ross, thank you for your patience from Crawford County. What did you want to say, Ross?
Hi, Jane and guests. Yeah, so what this conversation makes me think, one is that it's amazing with how horrible COVID was, how it gave us this Zoom world that we live in, and how in many respects it's so convenient. But the real point, I read an article, was it today, in the State Journal by Dave Walbrook, who writes about the health issues for the State Journal. And it talked about a guy, I don't know if he was on Medicare or if it was Badger Care, but he went in for maybe some kind of an Affordable Care Act. He went in for like what a routine general, like a wellness exam, and which is covered by the insurance. And then, the doctors asked him, so how are things going? And he mentioned, well, he's feeling kind of down, feeling kind of bad. And the doctor kind of, researched it or went into it, asked a little bit more questions. The guy gets home, and a month later, he gets a bill from the insurance company. Basically, I think it was from the actual hospital system through the insurance company. And it was because the wellness check didn't really, once they go off like a wellness doesn't, you would think it would, but it didn't necessarily include pursuing questions about mental health in this case. And I guess it could be about maybe some other thing. It could be like maybe cancer or something like that. But in this case, it was mental health. And the guy got socked with this $360 bill because, oh, this isn't wellness. This is a whole separate thing. And I'm only bringing this up because usually if we get mental health, we call, we say, hey, I need an appointment. And so everybody kind of knows up front, you're going in for a mental health exam or a clinic appointment. But I'm just sort of throwing it out there that depending on what kind of insurance you have and what kind of questions the doctors ask, you could be hit with a bill because you divulged some depression or you divulged some mental health challenges that you're having. So I kind of it's a kind of a tangential issue, but I just thought it was interesting because I read that today and it seems related.
Sure. Thank you so much, Russ. Really appreciate it. Insurance as a whole, we could do 3 entire shows just about the medical insurance industry.
Well, you could. I would hope you would have someone who's more of an expert on to talk about that. Yeah, that situation doesn't sound good. I'm not an expert, so I can't speak specifically on that instance. But the bill applies to people who receive mental health care via therapists or professionals who are solely mental health professionals. So it wouldn't cover your physical doctor or people like that realm, and it is intended to go toward people who actively seek it out. So I say I want to see a therapist,
Right.
But that does sound like an issue. Perhaps yeah.
Well, it's just it's just another good reminder to take a real good look at your insurance policy because there's all kinds of little caveats in there for what will and will not be covered.
It just sounds really like if you're sitting in the doctor's office and you're there for a checkup, and then they say some mental health questions, and you have to say, wait, is this covered?
See, and that surprises me because when I go to my annual with my doctor, and even for the last 5 years, I have been asked, how are you feeling? Are you having any suicidal ideations? Anything like that? And I've never received another bill for a mental health checkup for that.
I don't think I have either. I have the same thing. My physical doctor asked about, I think, depression and anxiety, things like that.
Almost every time now, which is good because it shows that it's on the radar. But again, to Ross's point, you want to be careful with your insurance company because
you just never know.
You
That's
really
the
don't
problem.
know.
That's the problem.
The last time I saw my doc, I asked about don't tell Dr. Lyerly because she'll be really mad at me, but I'm 63 and I haven't gotten a colonoscopy yet. I know I'll get one.
I'm telling.
Look at Greg's face.
I'm telling because I worry.
But I asked my doc, I said, it's my understanding that if you go in and you have a colonoscopy and everything is fine, that's covered. Once they find something, it's no longer covered.
Oh, that's a fantastic reason not to do it.
No, but I think that makes no sense to me as far as a health perspective.
Well, that's for another discussion. So,
all right, he's going to rat me out to Dr. Lyerly anyway.
Yeah, totally.
She will be here on Thursday at 11:06 for our public service announcement. We just got a couple of minutes left, Benjamin.
Sure.
What have you heard now from friends of yours now that you're actually getting something done, getting this moving? Are they just Are you still just their nerd friend, or are they all impressed with you now?
Uh, yeah. So my nerd friends think that this is nerdy, which is fine. But the perk of having done politics and been interested in politics for a long time is that you have a lot of political friends who are interested and care, and when you go out to the Capitol, you can see them and all that. So that's been fun. Yeah, and friends of mine who aren't as politically engaged are impressed that something is actually possibly moving and working. And I think they sometimes don't fully understand the whole process of how a bill becomes law, so they think it's cooler that I'm on radio. So thanks for that.
Oh,
But,
they do.
yeah,
Oh, well,
yeah.
we're happy to help you with your coolness factor.
We are tastemakers. What can I say?
Indeed.
Mhm.
Oh, yes, so
Nothing
much.
but the best.
Well done. Congratulations.
Thank you.
I have no doubt that this will pass and hopefully get moving very soon. So thank you for your passion about this and for your honesty about this, because
Yeah.
a lot of people wouldn't be willing to do that.
Can if it goes through and it passes and everything's good, can you convince both sides of the aisle and the governor?
Mhm.
Do a press conference. Get this in the paper.
Yeah.
1, to say it's here, and 2, to say we did it together.
We did it together.
Because I think both of those things together are fantastic. And I don't, I wanted this to happen, but I don't want it to be like, all right, page 42 of the paper.
Thank you so much for joining us today. Thank you, Benjamin. Thank you, Greg. Thank you, Calvin. Thank you for listening. Stay tuned. We have the new news coming up next, followed by the wonderful Todd Albaugh Show. Keep it right here on the Civic Media Radio Network.